10%? 0%.
Wise guy. 50, I've heard lots of different numbers. The article that I'm using from an online journal called Up to Date says 15%. I've heard anywhere from 15% to 1 in 3. Dr. Maalim, would you like to weigh in on this?
I agree with you.
Somewhere between 15 and 30%. Okay? Now, Dr. Maalim said several times last month that hypertension was a blank killer. What did he say over and over? Hypertension is a something killer. What did he say? Silent killer. Okay? This is one of the reasons hypertension is a silent killer. You don't even know, if you don't go to the doctor, get your blood pressure checked, you don't even know you have high blood pressure. Sorry to disappoint some of you true believers, but you cannot feel your blood pressure. You may feel emotional tension, you may feel upset, but that doesn't mean your blood pressure is necessarily high. You may feel really calm, but that doesn't necessarily mean that your blood pressure is okay. The only way to know your blood pressure is high is to go get it checked. That's the only way. That's something we had our community health workers spread. We spread that message all over the villages around our hospital so people would get their blood pressures checked. Okay? So, coronary disease is a silent killer for about 1 in every 6 people. Now I need my notes here for the next statistics. Yeah.
So how many times do you need to check your blood pressure a year? How many?
Well, blood pressure checking is so darn easy that that's difficult to answer. You could buy your own machine and check it 10 times a day if you wanted. I would say the answer depends on your blood pressure. It doesn't depend on how you feel. So she's asking if your blood pressure is normal, how often should you get it checked? And I would say probably every 3 months, but there's no right answer. But don't go 2-3 years without getting your blood pressure checked.
Okay.
We have people come into the clinic that haven't been seen by a doctor or had their blood pressure checked in 10-15 years, don't we? So that's the kind of thing I'm asking. So that's a really good question. But if you check it a few times a year and it's normal, just keep doing that. That's good. All right. So another big question is, how big a problem is heart disease? I think we all probably have a feel for that, right? Pretty common? Okay, here's some statistics to give you an idea how common it is. In 2010, according to the American Heart Association, there were 17.6 million persons in the United States with coronary heart disease. So we have about 300 million people in our country, something like that. So about 17, 18 million have coronary disease. Now, about 8.5 million of those have had heart attacks, and about 10 million of those have what's called angina or angina. That's heart pain that doesn't actually cause death of the muscle. It puts the muscle in jeopardy. The muscle is in danger of dying, but it actually doesn't die because a little blood is flowing. So, the word for that is called ischemia. Well, we'll teach you a few medical jargon terms tonight, just so when doctors talk to you, you know what they're saying. If you keep that rubber band on your finger, the end of your finger becomes ischemic. I-S-C-H-E-M-I-C, ischemic. And that process is called ischemia. So another word for coronary artery disease is ischemic heart disease. So if you hear that word ischemic, it happens anywhere in the body where arterial blood flow is blocked. Okay, let's have our slideshow. Let's have anything you want to show me. Click away. So here's a guy, and it shows his heart, and it shows a schematic diagram of an artery in his heart. And you can see a clean artery with blood flowing in the middle of the picture, but on the right, what's that yellow stuff?
Fat.
Fat. What's a specific type of fat that we talk about all the time? Cholesterol. Right. And that fat in the artery we call plaque. Have you ever bought in the store a mouthwash that's supposed to keep you from getting plaque on your teeth? It's the same word. Oh, this isn't on the outside, this is on the inside, and it's not calcium deposits on your teeth, it's greasy stuff. It's like lard, it's like butter, okay? In Pakistan we have a word called ghee. You ever heard of ghee? It's clarified, what is it, honey? Clarified butter? And it's like Crisco, it's like shortening. Any of you ladies bake with shortening? Yeah. At room temperature, it's a solid. It's not a vegetable oil, it's a solid. I know in Africa there's a lot of palm oil. Yeah. Okay, imagine palm oil on a really cold day that got solid. That's what that is. Okay? Alright, let's go through to the next picture. Now here's one. Same kind of idea. One of the arteries in the heart is partially clogged. Next slide. Now this is an actual picture of someone who didn't make it, and they did his autopsy. This is a cross-section of one of his arteries that actually caused the heart attack. Now, it's not a very big picture, I apologize, but I'm not very techno-savvy, so you have to bear with. But thankfully you guys have a beautiful big screen. You see an arrow in the middle of that, a little black arrow? That's pointing to a place where the plaque ruptured. The plaque broke, it cracked, it burst. And you see kind of a reddish purple thing towards the top in the middle? What do you think that is? If a plaque ruptures, what forms inside the artery where the plaque ruptured? This is our main lesson today. So we're going to all walk out of here knowing what this is. It's a blood clot. Everybody say it with me. Blood clot. If a plaque ruptures in an artery, what forms? Blood clot. So imagine you have an artery that's supplying a big portion of your heart muscle, right? And it's only 50% blocked with plaque. Okay? The cholesterol buildup is only blocked about 50% of the artery. That's plenty of open artery for blood to flow. You can shovel snow, you can run upstairs, you can get on your treadmill, and it won't cause you any problem. You won't feel chest pain, you won't feel shortness of breath, you won't feel lightheaded, you won't get sweaty, you won't get nauseated, your arm won't hurt, your jaw won't hurt. Everything will be fine. There will be no ischemia. But if that plaque ruptures in a matter of seconds or minutes, a chemical reaction occurs that causes a blood clot. And now that 50% blockage has suddenly become a 90, 91, 92, 93, 99, 100% blockage. Now you've got a very tight rubber band around your finger. And the heart muscle is dying. Okay? That's what causes a heart attack. Martha?
I have a question. In that blood vessel, the pink that's underneath the darker purple, is that plaque?
That's plaque.
It's all,
yeah.
Okay,
yeah.
so if the blood is flowing through there and the plaque cracks, why does the blood clot form?
Excellent. Why does this happen? I just said there's a chemical reaction. Let's go to the next slide. There's another one. The arrow is pointing where the plaque ruptured. So the light pink around the edge is the plaque, and the blood clot's the dark red in the middle. Next slide. See the plaque rupturing? See the blood clot going left to right? Okay, so why does this happen? On the inside of the plaque, the main substance is called LDL cholesterol. Any of you guys remember your cholesterol results and some doctor said you have an LDL of something? You ever wondered what LDL meant? That's the bad cholesterol. That's called low density, and then the next word is lipoprotein cholesterol. It just means that the cholesterol is bound with some protein. So your LDL is very lightweight. It floats in a test tube. So if you have blood, and you have enough cholesterol, it'll actually be on the surface of the tube. It'll float like oil when there's an oil spill. Oil floats on the ocean. So it's a very low density. Water is more dense than LDL. And it turns out that that stuff, when it contacts the bloodstream in high concentration, because in a plaque, that LDL is very concentrated into one little spot. Turns out that when that touches the bloodstream, there are chemicals, little proteins, that are ready to go into action, and it's like a domino effect. You know what dominoes are? Yeah. We played them when I was a kid. I don't know if many people play dominoes anymore, but it's a little thing that knocks over one and knocks over another like that, and it's a chemical reaction. Many substances are involved, and that forms the blood clot. So it's the concentration of the LDL that suddenly explodes to the bloodstream. It's usually covered over by what they call a cap. It's like a cap on your head. If all of a sudden your cap is off, everybody can see whether you got hair or not, right? So it's kind of like that. If the cap breaks, all of a sudden the blood sees that LDL. The other thing that causes it is something called inflammation. Now everybody knows what inflammation is because patients come up to us, doctors, all the time and say, "Doctor, my toe is really inflamed." And if you look, it might be red and swollen. They might have gout. Or they might have rheumatoid arthritis in their wrist, and their wrist is very painful when they move it. It's swollen and red. That's inflammation. If your gums are red and bleeding, you have inflammation in your gums. There's inflammation in plaques in people who smoke or have diabetes or who are overweight in particular. And it's that inflammatory process which involves many little tiny chemicals that makes these plaques very prone to rupture, and it triggers this cascade of events in the blood that forms a blood clot. So there are people who understand this way better than I do, but that's the basic outline. Dr. Salih, you want to comment?
It's actually as you described.
Pretty good? Okay. So inflammation is the underlying phenomenon here. It makes for an unstable plaque that's very prone to rupture. And so one of the things we want to talk about tonight is what can we do as normal people so our plaques don't, first of all, form, and second of all, if we do have plaques, how can we stabilize them so they don't rupture? Because none of us wants the big one. Any other questions? Yes?
What do you do when you get that fax in your system? How can you do to get rid of that fax?
I just saw you talk again. Sorry.
I'm asking about the fax that causing the blood to clot. What can you do for you to get rid of it?
How can you get rid of them?
Yeah.
You can't. You can't get rid of them. We think cholesterol medication like statins in some patients makes them a little bit smaller. There have been people who've had cardiac catheterizations where they squirt the dye in the arteries and take pictures, and they see like a 70% blockage. Then they go on cholesterol medication like Lipitor or Zocor or Crestor, and then so many months later or a year later they do the same procedure, and now it's not 70% blocked anymore, now it's 50% blocked. They call it the Roto-Rooter drug. But you can't count on that. Mostly what those drugs do is stop it from getting any worse and stop the plaque from rupturing. So there isn't any way really to clean up your arteries. That's why doctors do bypasses. When the artery is really, really blocked, if it's a certain artery in the body, or if you have 3 arteries, then they take veins out of your leg and they go around the blockage because they can't get rid of it. And sometimes there's calcium in there that makes it really rigid and tough, and you can't clean it out. Sometimes they put stents in, little tubes. They put a balloon in, and they blow up the balloon and open it up, and then they put a little tube in. It's called a stent to keep it open. But you can't just go and clean it out. There's no way to do it. So the bottom line is what your question is. Your question is excellent, sister, because what that means is we got to prevent this. Amen? All right. With God's help. Pardon me?
How can you prevent that?
Yeah, so that's the rest of the talk. Any more slides, or do we have video now? Okay, we're back to that guy again. So let's do a couple videos. I'll be quiet for a little bit. Oh, do you have a mic back there? Can you make the sound happen? Should I give you a microphone? This won't feedback if I come back, will it?
Blood. Coronary arteries, one of which we see here, fill that need. Sometimes a cholesterol plaque forms on the side of the artery, reducing blood flow. If part of that plaque breaks through into the artery, platelets tend to attach to it, creating a blood clot, further reducing or blocking blood flow. The blockage in the artery prevents blood from reaching part of the heart muscle. Without blood, the muscle is starved for oxygen, causing damage to the heart muscle. The heart attack occurs because the damaged heart can no longer pump properly.
My heart's pumping now. Please, the other video.
Boom, 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 boom. What causes a heart attack?
We're in Australia now.
A heart attack, or myocardial infarction, means that there is death of some of the heart muscle. This is caused by a blood clot blocking an artery and resulting in a lack of blood supply. As we get older, the smooth inner lining of the heart arteries becomes damaged and thickened due to the accumulation of fatty material called atheroma, made up predominantly of cholesterol. This process is known as atherosclerosis. Previously, it was thought that a progressive narrowing in the coronary artery caused heart attacks. It is now clear that this process can sometimes occur in coronary arteries that have minor narrowings when cracks or fissures develop in plaques. The exposed damaged inner lining of the coronary artery wall causes blood cells called platelets to stick to the damaged area and stop the formation of blood clots within the artery. These blood clots prevent the flow of blood, vital for the heart muscle to survive. If the artery is blocked for more than a few minutes, the muscle cells beyond the blockage may become permanently damaged. It remains unknown why heart attacks happen when they do, sometimes affecting people who seem to have been perfectly well. Certain factors are known to increase the risk of having a heart attack. Smoking, family history of heart disease at a young age, high blood pressure, elevated cholesterol levels, lack of physical exercise, diabetes. The heart muscle that is injured by this blockage may become irritable and can cause irregularity in the heart rhythm. This can be fatal by causing a cardiac arrest, even when it appears that very little heart muscle is being damaged. This is why it is very important, if you think you're having a heart attack, you should call for an ambulance. If having taken GTN, 2 parts at 5-minute intervals up to 15 minutes, your symptoms have not resolved, you should call an ambulance without delay. The damaged heart muscle eventually heals with a scar, but may not be able to pump quite as much as it did before. In the majority of patients, however, there is enough good muscle left for the heart to function adequately, and for recovery to be complete.
Thank you very much. Let's give a hand to our brother who does that. He saved the day for me because I didn't bring a flash drive, but he problem solved on the fly for us tonight. GTN is a phrase we don't use in America, but I think what it means is nitroglycerin. And the only people that would have nitroglycerin pills are people who already have heart disease and their doctors gave them a prescription. Or the ambulance guys, paramedics, they have nitroglycerin. But you're not going to be able to go to your local pharmacy and buy GTN. So you have a handout now. Hopefully most of you can see either yours or your neighbors. One of them has orange highlight on it. Could you pull that out and look at it? Make sure everybody near you can see. The very first highlighted word is, what are the symptoms of coronary disease? And down below that says the symptoms of a heart attack. Everybody knows chest pain. But did you know that women often don't get chest pain? Heart disease in women is different than men. And traditionally in this country, years ago, most doctors were men. And most studies of heart disease were in men. It was a very chauvinistic business.
Why?
I don't know. That's something to be ashamed of, I guess. But in my medical school class that graduated in '79, there were more women than men in my class. So that was the start of a revolution, maybe. But we've paid more attention in recent years to studying women and heart disease. And one of the things we've learned is that women don't always have chest pain. So the young doctors in particular, like Dr. Maalim, considerably younger than me, he's been trained to not be deterred. In other words, if a woman says she has no chest pain, if she has risk factors for heart disease, he is not deterred from suspecting that she might be having angina or, even worse, a heart attack. And so what symptoms might a woman have if she doesn't have chest pain? Any thoughts? It's on your list there, where we are talking about the orange highlight. Sorry? Speak loud, I can't hear very well, I'm old. Shortness of breath, thank you. Anything else?
Feeling dizzy or lightheaded.
Dizzy or lightheaded, yeah. Sometimes women who have heart attacks suddenly feel exhausted.
There's
They
4
can't do
minutes
their work.
of memory.
And it's not that they have bad
There's
night's
4 minutes
sleep.
of
It's
memory.
totally out of the ordinary for that person that feels so
Okay.
exhausted.
When it's done.
Okay? Right, so when you're doing some physical activity like the laundry, or maybe you're walking upstairs or going up a hill, and all of a sudden you feel like your legs are going to give out, you're so weak, and maybe it's hard to breathe, you should think heart. Okay? The same is true for people with diabetes. We talk about silent ischemia in diabetes, and that happens to be true of only men. Diabetes doesn't make women more prone to silent ischemia than they already are, but it does make men more prone to silent ischemia. That's one of the things I learned in preparing for this talk. So if you're a guy and you have diabetes, you won't necessarily get chest pain with your heart attack or your angina.
Only
You may
5 to
just
4
feel
minutes left or
tired,
something.
nauseated,
The memory.
sweaty, clammy.